Hi, I'm Dr. Mayank. I'm a board-certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery, doing hair transplant surgeries over the past 12 years in New Delhi. Today, we are going to discuss a very interesting case. A patient who was 39 years old, male, came to us with diffuse pattern hair loss. The most interesting part was that he was on medications for over a year and a half, but was not regaining what he had lost. The clinics where he had visited before had advised against the hair transplantation in view of his existing hair in between the gaps that he had developed. He was informed that the gaps are not adequate and probably just the hairline restoration can be done. So let's have a look what was the presentation like. So this is the diffuse pattern hair loss what the patient had. It is called as a forelock retention pattern. It doesn't lie in the typical male pattern baldness classification. He had lost the frontal area, the frontal tuft was retained, and he was having diffuse gaps right from the front till the crown area. This forelock tuft gave the impression that he was not having hair loss grossly from the front view. In view of the planning, what we decided was that we would just lower the hairline marginally, covering the front area, giving him the coverage to the frontotemporal areas, going beyond the forelock area as well, and covering all the gaps right till the anterior crown. In terms of the planning, the technique decided to cover this was a combination of FUT and FUE. As per his donor density, we decided we will do close to 35 to 3800 grafts, which was amounting to around 5500 to 6000 odd follicles. So the planning of the donor was done in a manner that the crown, which was receding till the posterior part, we left approximately around 3 to 4 centimeter lower part of this as well, so that we don't harvest any follicles from this area, which could be the area where the baldness could encase in future. The lower part of the donor area was also left virgin for the future. This FUT, as per the laxity, was decided, and post the procedure, this was the implantation where you can see the high density coverage of the frontal area, including the gaps in the forelock tuft as well. That area was not left as it is. Coverage of all the gaps of the midsection as well as the anterior crown. The entire process took around 8 to 9 hours, and let's have a look at the follow-ups after the surgery. So this is the 1 month appearance of the front and the oblique view and the top view as well. So this phase is usually when you would see majority follicles shedding off and the growth starting after about 3 to 4 months. 2 months down the line, you would see that the growth has already started. The definition to the hairline has started coming. The fullness of the hairline zone, the front area, forelock, as well as the midsection gaps have started covering. Approximately 4.5 months down the line, we can see that the hairline is well defined and the coverage of the mid as well as the crown regions has fused along with the forelock tuft what he has. So it cannot be identified which part was transplanted and which was his original hair. Approximately 6 years down the line, if you look at the patient, his scalp looks full. Obviously, there is some amount of thinning which starts coming in over a period of time, but it looks as something which is natural as per his age now as well, who is close to now 45 years of age. So the key points what we want to basically tell you is that the hairline planning should not be done as per the age where the patient comes to the clinic. It should be done with a view that in future, as the face ages, we would have some amount of aging, wrinkling, which would look unnatural with the low hairline, and in that case, it would always give you an unnatural appearance. So with his age and the coverage, we can see that the density gives you a decent appearance overall over the years, whether it's 5 years, 6 years down the line. We also need to understand that over a period of time, the patient will lose density again and may require going in for another transplant. That's why it's critical, although the patient had used the medicines pre-surgery, but that medications are for only the retention of his existing native hair. If he chooses not to take the existing medications what have been given for the hair which he had before the transplant, then the gaps continue increasing over a period of time and he would be back to square one, requiring another transplant, for which as well we have preserved adequate amount of donor area for future coverage. What I'd like to especially tell all of you is that diffuse pattern hair loss is something which is very prevalent in today's date. Whenever we go in for a procedure, please take proper professional guidance and advice by visiting the hair transplant surgeons so that they can exactly calibrate by the follioscopic analysis whether you are a candidate to do a hair transplant in that situation, or you should just continue using the non-surgical medications and treatments to retain what you have and try to reverse the thinning if the follioscopy is suggestive of some amount of excessive miniaturization in the recipient area. Again, the point comes that the case was taken because the patient had been on medications and along with that had also lost the definition of his hairline, that is the frame of the face. So this gives you a fair idea about what is the candidature for a surgery and what is the candidature for just medical management. I hope I have addressed all your concerns regarding the diffuse pattern hair loss, what is usually today's concern for most people. If you have any further concerns or questions related to similar patterns, then feel free to give us a message or a call on the numbers given below. Thank you so much for sparing your time to view this video, and please like and subscribe to our channel for more of such interesting content. Thank you.